I think it began in the 1980s and early 1990s as we saw that we were experiencing double-digit increases in the percentage of healthcare spending every year, as we saw how much it costs to treat someone who's already sick. It became clear that if we prevented disease in the first place, we wouldn't have that astronomical spending. What our country is trying to do right now is to make it possible for everybody in the United States to be able to buy and to afford to buy those health insurance plans. The most recent numbers actually said that the government had exceeded its goal and actually had 8 million people sign up for health insurance, which I think most people agree was better than anyone would have expected given how rocky the start was. And so, time will tell if people will stay enrolled, but I think in general, so far, it's been a success. Instead of being a culture focused on sick care, we're becoming a culture focused on staying well and staying healthy. And that's where my having a public health background, yet teaching about healthcare organizations and healthcare administration really helps, because that's the orientation we're moving toward, is trying to prevent disease instead of curing it. And that's really what public health is all about. I began reading all of the data that has been coming out in the last few years about how sitting at a desk over your entire work life can actually cut your life years short. And so I thought, well, I really should be, for lack of a better term, kind of walking the walk and being someone who really shows, how you can have a healthier workplace. And I crave getting into work every day because I'm so excited to actually be getting physical activity as well as doing my intellectual activity. So I really have enjoyed it quite a bit. It's a real added bonus. I love my job, I love teaching, I love interacting with my students, but it's a great bonus to be able to also be physically active every day.